It's a question that's been fiercely debated for 12 months. What's the best way to provide care in West Wales for the youngest patients of all? Almost exactly a year ago, NHS managers gave the go-ahead to changes, which included closing the special care baby unit here at Haverfordwest. By developing a larger, more specialised unit at Glangwili Hospital in Carmarthen, they argued mothers and babies needing extra care would get better treatment. Others claimed patients across Pembrokeshire could be put at risk. Last Wednesday, Kate Sutton from Johnston was rushed to Witherbush with severe bleeding. She was 35 weeks pregnant. Sadly, she lost her baby.
They told me that night that if I would have had to have gone to Glangwili, I would have not survived. I was minutes from death, and if that service was still not available like it was to me that night, I would not be sitting here today.
The local patients watchdog was so concerned it vetoed the Health Board's original plans, which meant this afternoon he had to make a final decision. After taking advice from a panel of experts, Mark Drakeford rejected the appeal.
The scrutiny panel, following its further work, has concluded that it has not been presented with any additional evidence that leads them to question their original support for the Health Board's proposals to develop a Level 2 neonatal unit at Glangwili. Indeed, the panel expressly endorses the Health Board's intention to move to midwife-led units across the Hywel region.
The decision to close this unit will, I believe, undoubtedly put lives at risk in my constituency, and that now lies squarely on this government's shoulders.
It is simply counterintuitive to tell people that to travel further away for a service is a better service for them, because all their instincts tell them something completely different.
I want to put it to you that before we venture down this, we have to be absolutely certain that this safety net is not only in place, but is robust and able to deal with the changes coming forward.
The changes will mean mothers who need emergency or consultant-led care during their pregnancy or while giving birth will have to travel further. If they live in St David's in Pembrokeshire, that would be 46 miles to Carmarthen, a journey of up to an hour and a quarter. But the Health Minister insisted an emergency transport system would be developed to transfer mothers and babies in a hurry. He also said there would be a safety net in place while the new system gets up and running, with obstetricians staying on at Witherbush and at Glangwili Hospital, which will also become a midwife-led maternity unit. Dr Chris Overton is a consultant obstetrician at Witherbush. He came all the way to Cardiff Bay to listen.
It's quite clear that there's a number of people who will just not get there in time, whether there's emergency transport available or not.
We'll have a good way forward now with developing our paediatric and neonatal services to improve the quality and safety of our services for the population of Hull Health Board.
Most mothers, the Health Minister claimed, won't have to travel further to give birth. But those who need to, he insisted, will get better care. But that's unlikely to silence the critics who are already planning to challenge this and other decisions in court.
Owain today is all about services in West Wales. Is that the last word now? Is this it?
Not really, Jamie. Lots of questions emerging this evening about the detail. For example, Mark Drakeford said that most mothers, if they're able and choose to do so, will be able to give birth, still be able to give birth at their local hospitals. Plaid Cymru, for example, asking how can that be the case when it's estimated that the number of births in Witherbush will drop by around 3/4. What this boils down to, Jamie, is a fundamental difference of opinion, which I suspect now can't be reconciled between those who believe this will lead to better care and those that don't believe that will be the case. Although the Health Minister, Mark Drakeford, did say he'll hold a review in a year's time to find out whether or not this delivers better care. Now, this was supposed to be the final chapter, Jamie, in a long-running saga of West Wales hospital reorganisation. But if you think you've heard the last of it, well, think again, because I understand campaigners are hoping to challenge several of these decisions in court, seeking a judicial review, not only about neonatal changes, but also changes to A&E in Llanelli and the closure of a minor injuries unit in Tenby. Soon we'll get to find out whether or not they get the chance.
And just bring us up to speed on health service reorganisation in other parts of the country.
few details to be hammered out in North Wales after the First Minister proposed a revised plan for neonatal care there. But the big unanswered question still is, what will the plans look like for South Wales? Now, we know they'll involve centralising some hospital services like A&D, but the key question is where. Now, there was supposed to be an announcement last month. It was cancelled at the very last minute. We're hoping to get an announcement next month. That's a sign, Jamie, that these decisions in South Wales could be equally controversial to those in West Wales.